Hello, this is Vaishali and I'm reading from the book Spirit of Homeopathy, book written by Dr.Rajan Sankaran. Mind section, chapter number 32. Some hints on case taking. Number 1. Ask a question in the opposite direction. If you want to confirm that the patient is really mild, you ask him, do you get angry? Often even a mild patient will say yes. Ask him next, when did you get angry? A mild patient will think a lot and tell you 7 months back. Ask him again, when did you get angry before that? Then he will really have to exert his mind and remember an incident. Or for example, ask a patient who you think is very sad, when do you remember being very happy? A sad person will be able to give you only 2 or 3 such instances in his life. It means that it requires a very joyous occasion for him to be happy. Sometimes even this occasion produces no reaction. If you think a person is a coward, then do not ask him anything about his cowardice. He may straightway say no. Ask him to give some instance when he stood up to someone and fought back. This instance will be very rare in the life of a coward person. Now number 2. Always confirm symptom from the relative and friends. Observe the expression on the face of the person accompanying the patient while the patient is narrating his symptom. You will often find an involuntary affirmative nod of the head or the shake of denial if person agree or disagree with the patient's evaluations of himself. Sometimes you can turn around and ask the accompanied person if he agrees or disagrees with what the patient has said. This is the best done when the patient is out of the room. Number 3. Never accept what the patient says at face value. Number 4. Look at the hidden expression behind the symptom. Like, see the way a symptom is expressed. You ask the patient, have you any fear of darkness? He said, never. I have never had any fear in my life. I can walk in the darkest and most deserted street at night and I have absolutely no fear. This is to be taken not as an absence of fear but boastful brave behavior. Number 5. The symptom expressed with the spontaneity, clarity and intensity is of higher value. Always consider that symptoms. So watch out the symptoms which go beyond the direct response to the specific question. For example, if you ask a patient, do you weep easily? And he answers, yes, especially when I see others suffering. Then you can get a hint that the patient is sympathetic or sensitive. Number 6. If the patient is markedly irresolute, these symptoms will be best elicited when you ask him about the craving and aversion. It will take him a long time to answer because he has to come to a decision and not simply state a fact. Number 7. Try to confirm the essential parameter of the person. This component will be the same in all situations, only their expression will be different. So you must use some imagination as to how this essential could manifest. For example, if you think a person is timid when appearing public, ask him about all the possible situations where this could become evident, like public speaking, parties and gathering, etc. Number 8. Try as much as possible to avoid asking the patient direct about his nature. Try to lead him through other questions to express it without being conscious of doing so. In South India, there is a proverb that we must go as smoothly and unconspicuously as a needle in a banana. And if if you cannot elicit characteristic symptom in the patient's present state, you have to go back to the time when the last characteristic symptom existed. You can look for this in 3 situations: characteristic after stressful situation, characteristic of illness before medication. If both are not present, they elicit the characteristic feature of the patient in the childhood. Number 10. I give a standard questionnaire form which asks questions about the patient's past history, present complaint with morality, etc., personal and psychological history. I have found it very useful for the following reasons. The patient get prepared to answer your kind of questions. Sometimes the patient can express some problem more freely in writing. It gives you the chance to go directly into the homeopathically relevant questions rather than losing time in irrelevant detail. For example, chief complaint, treatment, etc. Number 11. The expression of characteristic can often be easily provoked. For example, by making the patient wait beyond his time of appointment, is he patient or impatient, mild or rigid, or is he restless or calm? Number 12. Beginners in homeopathy often feel the need to put question after question, especially if the patient stops talking. They immediately ask the next question. This should be avoided. Most patients brings out the best symptom if you give a pause after the answer. When you ask a question, the patient will give answer immediately. After this, if you give a pause, he will think about the answer and then after he modify or even completely change. Sometimes he may say something very spontaneously and this may be the most significant. So a pause means a doctor is telling the patient, I am not trying to get answer but I want to understand you and tell me everything. This is should be tell patient. And other statement is I want to know and I am going to give you enough time. Take a pause and think and tell. Number 13. The patient should feel that the doctor is someone who cares, whom he can trust and whom he can reveal everything. Only then will be really open up. Now for 14 number, what the patients ask you is more important than what you ask him. Many symptoms like anxiety about health, superstitious fear, fixed ideas, suspiciousness or impatience can be easily judged from the patient's question. For example, if you visit a patient with a high temperature who says, Doctor, how soon will my temperature come down so that I can get back to my business immediately? The patient has a high temperature, lack of appetite, tremendous weakness, and the whole family feels anxious about his health, and his only question is when he can join the business again. That's become the highly characteristic feature of him. Now number 15. If you come to data and case taking and just do not know how to make the patient talk, just ask him to describe one typical day in his life, his routine from morning to night. You will find many leads from this narration.